My name is Aidan Shaw, and I'm a consultant interventional radiologist at Maidstone and Tunbridge Wells. I'm currently the clinical director there as well. I knew I was going to be a doctor from a very, very early age. I actually, unfortunately, had a few injuries playing some sport, and that spurred my interest to initially do orthopedics, and then that graduated into surgery, and then I then fell in love with interventional radiology. I was heavily involved in doing surgery from an early age, and as I started going through as a surgical registrar, I also accomplished getting my surgical exams. I started seeing interventional radiology, and I thought, well, this looks like a really exciting field to be in. So I went and got some experience with it locally in my local hospital, and I thought, yes, this is only going to get better and better. And that's really why I chose interventional radiology. It's a minimally invasive approach to treating conditions, meaning that we can transform patients' lives with day case procedures and local anesthesia. It's fascinating and only ever increasing. It's making a huge difference to patients' lives, whether that be through cancer or pain. There's not through minimally invasive techniques. I don't think there's no other specialty out there that like it. Just for example, on last week, I had a patient who couldn't swallow, was told that they couldn't have any further treatment. And with a minimally invasive approach and placing an esophageal stent, she was crying and able to eat and drink again. And then the same week, you're treating a patient who's got chronic pelvic pain, who can't pick her children up and can't live her life and has got no quality of life. And through a minimally invasive procedure, she's now able to live her life again, go to the gym and pick her children up. It's an unbelievable it's an unbelievable place to be able to have this ability to transform patients' lives, and I feel very lucky to be in the field that I'm in. I'd like to think that patients think I'm understanding and that I take all their thoughts and concerns into account. I always speak to my patients prior to any embolization procedure, and also I like to closely follow them up as well. I'd like to think that they think that I'm a caring doctor and like take their considerations highly into account. I treat a number of patients, from cancer, from palliative patients to elective patients and embolization patients. So every single patient I treat, I take into account their values, and everyone's from different backgrounds. So as long as you're treating the patient and listening to their symptoms and concerns, then everyone needs to be treated with the same level of respect from whatever level of background they're from.